Hi, I'm Whitney Morgan, functional health coach, creator of the Thyroid Reboot Method, and co-founder of the Functional Health Alliance. Suppose you're trying to get a handle on your elevated thyroid antibodies. Well, in that case, the first and most important step is to identify underlying triggers and eliminate them. And that almost always requires running functional lab tests. But in addition to that process, there are a few supplements that can help. So in today's video, I'm going to review each of those supplements and give you some tips on how to integrate them into your Hashimoto's healing strategy. But before we jump into it, go ahead and hit that subscribe button and the little bell next to it so you'll get notified every time I post a new video. Now, from the get-go, I want to be very clear that you shouldn't make any changes to your supplement regimen without discussing it with your medical provider or your functional health coach first. I also want to mention that the information contained in this video should not be considered medical advice, and it's not a substitute for healthcare from a licensed practitioner. Having said that, I use 3 supplements pretty frequently with my clients to help stabilize thyroid antibodies. The first one is selenium. Selenium is an essential mineral that plays a vital role in thyroid function. Unfortunately, many women with Hashimoto's are deficient in selenium. And in some cases, a selenium deficiency is enough to actually trigger Hashimoto's. Selenium is also important because it aids in the conversion of T4 to T3, and it also protects the thyroid from oxidative damage. So when you don't have enough selenium, your active thyroid levels decline, and excess oxidative damage can trigger an increase in thyroid antibodies. Studies indicate that just 200 micrograms of selenium each day can help reduce TPO antibodies by up to 40%. In addition, selenium has been shown to reduce the anxiety and depression that is often associated with Hashimoto's. Now, many people assume that if there's selenium in your multivitamin, you're covered. But that's not often the case because the RDA recommendation for daily selenium is far below the therapeutic dose you need in order to address thyroid antibodies. Also, nutrients that are contained in a multivitamin are just harder to absorb. That's why if you're using selenium specifically for thyroid support, it's best to take it separately. In addition, if you suspect that you have any malabsorption issues, which is pretty common with Hashimoto's, you should take your selenium on an empty stomach in the morning, along with about 400 IUs of vitamin E. That will help absorption. Okay, the second supplement I want to mention is myo-inositol. Myo-inositol is necessary for thyroid health, reproductive health, and also blood sugar regulation. It's a type of natural sugar that's produced in the body, and it's also found in certain foods. Research indicates that combining myo-inositol with selenium is actually a more effective strategy for reducing thyroid antibodies than taking selenium on its own. And the standard dose recommendation for daily myo-inositol is about 600 milligrams. In addition to its role in reducing thyroid antibodies, myo-inositol has also been shown to help reduce symptoms of anxiety, depression, and OCD that are sometimes associated with Hashimoto's. And because thyroid antibodies are often triggered by blood sugar imbalances, myo-inositol's role in regulating blood sugar and improving insulin sensitivity is particularly beneficial. A word of caution though, pregnant women should avoid myo-inositol, and so should anyone with kidney disease. Have you had success using strategic supplementation like this in order to lower your thyroid antibodies? If so, let me know about it in the comments. All right, the last supplement, systemic enzymes, also known as proteolytic enzymes. Now, these enzymes are different than digestive enzymes. They act as immune modulators and also reduce systemic inflammation. Systemic enzymes break down the inflammatory cytokines that are associated with autoimmune disease. They also help lower thyroid antibodies and antibodies that are made in response to food sensitivities. In addition to their role in thyroid support, systemic enzymes can benefit those with food sensitivities, chronic pain in the body, and also high cholesterol. 2 things to remember though. Number 1, systemic enzymes should be taken on an empty stomach. Number 2, the dose required to reap these benefits from systemic enzymes is often much higher than the dose that's indicated on the product label. Now, as with myo-inositol, pregnant women should avoid taking systemic enzymes. There are also a few other contraindications, so please make sure to discuss systemic enzymes with your doctor or with your functional health coach. To learn more about my thyroid reboot method and how to rebuild thyroid function from the ground up, click on the link that I provide in the video notes. If you're watching the replay on Instagram, just head to my bio link. Thanks for watching. If you found this video helpful, you can let me know by liking it, subscribing to my channel, or sharing this video with someone with Hashimoto's. Also, if you have questions, leave them for me in the comments. I'll see you next time. Bye.